As the country joins the phase 3 trial for the Russian vaccine Sputnik V, the COVID-19 caseload continues to rise while Mega Manila is on the last days under the two-week MECQ. Health experts have cautioned the public against setting all their hopes on a vaccine and instead continue to be vigilant in observing health protocols. But how far are we in lowering transmission? We discuss in this episode of the Chiefs. Welcome to this special edition of the Chiefs. With me right now is Lucy Cruz Valdez of News 5. Lucy, tayong dalawa pa lang, ano?
Hello. Oo nga eh. Yeah. Okay. What's up?
Kamusta?
Yeah.
Well,
We're still on the
actually,
vaccine.
ito pa rin yung
I think.
pinag-uusapan natin, di ba? Yung
Yeah.
kahapon pa in this news, if we're going to take part in the phase 3 trial for this Sputnik V Russian vaccine. The supposed
1,000 Pinoys, no? 1,000 Pinoys ang pwedeng mag-trial. Ang tanong, paano ba yan? Voluntary ba yan? Pipiliin ba yan? Gano'ng of all, safe ba yan? Okay lang ba yun? Okay lang ba yun na mag-trial muna dito? Considering na doon, pinasa na nila without completing the trials, no, in Russia. Parang should we trust that?
Siguro, I mean, among other things we have to remember, diba, there are international standards. Among the agencies that are warning against rushing into this are organizations like WHO. So that's one thing to keep in mind. And then yung protocols natin dito. But yun parang for me, it's really a question of ano ba yung protocols, di ba? As long as nasusunod yung protocols natin, the protocols, they do include trials, di ba?
Yes.
They do. So for me, that's one of the first things I'm really curious to know. Ano ba talaga yung protocols? And talaga ba sinusunod ang mga protocols dito?
Well, sabi naman ni Dr. Herbosa kagabi, di ba? When we interviewed him, na there are actually several units, no, under the universal healthcare na mandated na siya, di ba? You go through a DOST team, I think, di ba? And then within the Department of Health itself, I think they put up a separate unit just for the testing of vaccines. They were coming off the Dengvaxia experience, di ba?
Yes.
And at the same time, naging by law, dapat talaga dumaan sa ganon, no? Now the question is, of course, these are the same people generally, no? And you kept questioning the political will because the president himself, no less, has already said, game na ako dyan, di ba? Tuloy na yan. So, pag meron kong pressure, you wonder
in fairness to the Duterte administration, di ba? At tinatanong naman ng mga tao, hindi lang yung political pressure, hindi lang yung political will. Ed was pointing out, paano yan? Nagsalita na yung presidente, may pressure ba kasama dyan? But it's not just political will, it's also political realities. Di ba?
Yes.
Remember, Dengvaxia kept coming up in our conversation precisely because even without these new laws na binabanggit ni Dr. Herbosa, we had health protocols. We had protocols about kung kailan pwedeng ipatest sa mas maraming tao yan. And the fact is, among the words that came up yesterday was baka nabraso, di ba? That came up in the conversation. And also, doon sa kabilang side, even what Dr. Herbosa would say was, we hope that the government will listen to the scientists. That gives you pause. We hope, akala ka pa may protocol.
Baka dapat autonomous yun, ano? Pwede ba yun? Pero pag ginawa mo naman autonomous, lalong hindi mo mapakialam kung anong nangyayari sa loob, di ba? So parang, I don't know, everything is now really resting on the credibility of the ones who will implement or execute, no?
Kaya nga, ang mahalaga dito, di ba, eh hindi ka nagmamarunong. Di ba? Yun ang hindi ba, ayun, kaya tayong dalawa, wag na rin tayo magmarunong. Magtanong na lang tayo ng yes na.
Correct. Game na.
We're very fortunate to have with us one of the hardest working people in the Department of Health and in this job of having to speak for in very chaotic times. Undersecretary Maria Rosario Vergeire of the Department of Health. Usec Vergeire, maraming salamat po. Welcome po once again to the Chiefs.
Good evening, sir. Good evening, Luchi.
Okay. Ma'am, I'll start with the catch-all question. Where are we with regards to Sputnik V? Ano po ba ang participation natin dito? And let's start with that. I mean, what can people expect? Are we in this or not? And what does it mean, whether we're in it or not?
Well, we are on to the negotiations part pa lang po, no? So yesterday, Department of Science and Technology had a meeting with the manufacturers already, yung sa Gamaleya, and they have tried to discuss it with them already, exploring the different avenues, and tinitignan po natin kung ano ang pwede nating gawin. No? So Department of Science and Technology would be the right agency to give all the details for this. But just so that we would want everybody to know, no, even though we are going to have, if ever, no, we are going to have the clinical trial here for the phase 3 clinical trial of the Sputnik V. It is going to undergo all regulatory processes of the government. So once a vaccine comes in, whether it be Sputnik V or the other vaccines that we are trying to negotiate, ngayon po currently, all of this has to undergo our regulatory process, meaning it has to undergo ito pong clearance process from FDA. They have to evaluate it. Aside from that, the basis for the evaluation, aside from the dossier where technical details of the vaccine will be studied, we have a vaccine expert panel which is under the Department of Science and Technology, and they would be helping us in evaluating all of these vaccines that we are trying to negotiate for across the globe, no? Kasi marami na po talaga mga bakuna ngayon ang meron. And then pagkatapos po nun, meron pa po tayong ethics review board na dadaanan because this is a clinical trial. And everybody going to be identified as part of this trial will have informed consent. Ibig sabihin, ipapaliwanag sa kanila kung ano itong bakunang ito, ano ang magagawa para sa kanila, the benefits, and also adverse events that might happen if ever they will be given the vaccine. So all of this will be undertaken by government before we can be able to start the implementation, if ever, of this phase 3 clinical trial.
Okay, now ma'am, before I ask my question, let me just welcome Mami Pamintuan of Philippine Star. She joins us again. Ma'am, sundutin ko lang ang konti yung a little more details. No? So, pagka sinabing we're taking part in the trial, ilang tao ba po pinag-uusapan natin dito? The very first phase, ilang tao pinag-uusapan natin? And sabihin yung mga taong yun, how long yung testing and so on?
Depende po yan, no, sa protocol na bubuuin, because in every clinical trial there is a protocol. We will be identifying a proponent, for example, that would be managing, no, this trial, that if it's going to happen here, no. So may protocol na bubuuin dyan, is-spell out dyan, ano, base dun sa mga pag-aaral kung ilang tao ang kailangan para maipakita natin yung resulta. Because when you say it's a clinical trial and it's in phase 3, you try it out with thousands of people, no? Hindi na katulad ng phase 2 at phase 1, kakaunti lang ng mga tao yan. Ito po, madamihan na po na tao para makita natin kung talagang yung bakuna ay talagang nararapat at saka ito ay effective against COVID-19 talaga. Diyan po yan ipapakita dyan sa phase 3 clinical trial. So it will depend on the protocol, how many individuals will be included, ano pong mga areas, gaano po katagal, yan po ay ilalagay lahat sa protocol.
So lahat po ba ng vaccines na yan, sabay-sabay as they come, paano po yan i-introduce sa atin? Are the manufacturers gonna come here like in a bidding and offer their product, or are we going to scout around the world to see which vaccine we can afford or we want to try? How does that work? Yung selection ng vaccines.
Actually, there had been a lot of offers already for the country. Currently, we have 16 manufacturers of vaccines that we have different stages of negotiations with. And this is through bilateral partners. So yung 16 na dyan, kasama rin po dyan sa 16 na kinakausap natin ngayon, yung mga medyo advanced stages na ng kanilang trial, nasa phase 3 na rin po sa iba't ibang bahagi ng mundo. Meron din po tayo yung atin pong sinalihan, yung COVAX facility, kung saan meron din pong 9 na klaseng bakuna na kasali dyan. So in total, makakakita po tayo ng marami no, na mga bakuna na tinitignan natin kung ano po yung magkakaroon tayo ng final agreement with these manufacturers, and it's going to be feasible and applicable here in the country. Ang isa po sa tinitignan natin, and I think it's important, even the Department of Science and Technology, sinasabi rin naman ho pag nag-uusap kami sa Sub-Technical Working Group, kailangan talaga na i-try out ang ating phase 3 clinical trial dito sa bansa para makita natin sa local setting natin. Kasi po ang mga bakuna, meron po silang mga characteristics na minsan iba ang effect dun sa ibang specific population. Like there are ethnic groups na merong iba ang epekto sa ibang bakuna compared to another ethnic group. So that is why it is really important that it can be tried out also here in the local setting, like here in the Philippines.
So kung ano man yung mapili natin, ita-trial pa yun lahat. Ganon. Ganon po ba yun?
Yes, Lucy, no? Kasi wala pa naman nakakatapos ng kanilang mga trials all over the world. Ang pinaka-advanced na stage na bakuna pa lang all over the world, nasa phase 3 clinical trial pa rin. So wala pa rin talagang nakakatapos.
So bakit tayo nakapirmi dun sa Russian Sputnik V?
No, we're not saying...
Bakit yun yung parang ngayon, yun yung lumulutang na yan ang ita-trial? Is it because they're ahead of all the others? Is that the only reason why we're focusing on this Russian vaccine?
No, Lucy, we're not just focusing on that Russian vaccine. There are other, as I've said, we had been negotiating for some time already with different vaccine manufacturers, no? So I think that we started off June pa or May na nag-umpisa po tayo sa iilan no ng mga manufacturers, and now as I've said, we already have 16 no in different stages of negotiations, and another 9 na bakuna na kasama sa COVAX facility. So hindi po tayo nagsi-single out lang. Tinitignan pa rin ho natin, we're scoping and tinitignan natin what would be most applicable and what would be most beneficial for the Philippines.
Usec Vergeire, we're not focusing on the Russian vaccine, but there's a lot of excitement about it dahil nga sa announcement ni President Putin, and because our president himself keeps mentioning it at sinasabi niya he's willing to be a guinea pig. Although mukhang hindi yata siya pwede dahil sinabi nga sa amin na hindi daw pwede yung mga elderly doon and people with comorbidities, no? But realistically, ano yung reasonable time frame for a vaccine? Ito, third phase pa lang to ng clinical trial. China, I think, has almost finished with the third phase already. What's the reasonable time frame for a vaccine to be actually available for mass administration in the Philippines? Kasi yung sinasabi, kung si Presidente daw, baka sa May pa, kung papayagan siya.
Yes, actually, ma'am, pag tinignan po natin ang proseso ng mga clinical trials, we have 4 phases. And we have the phase 4. Hindi lang po yan matatapos sa phase 3. Kailangan may phase 4 din po yan. Kaya lang sa ngayon, because there is a public health emergency, ipinapasa ngayon sa Kongreso, no? Nagbigay ho tayo ng rekomendasyon sa Kongreso, and this was supported by our experts, no? Na i-exempt na lang ang phase 4 muna for this time being because of the public health emergency, that we can easily access ito pong mga bakuna. Kasi kapag po inantay natin na matapos ng phase 4, and that would really take long. Kaya po napag-isipan at inirekomenda na sa phase 4 i-exempt muna, although there had been specific conditions which was provided by our experts. Of course, it should be acceptable and aligned dun sa mga standards ng WHO at approve ito ng WHO and other reputable and recognized na mga international institutions and medical community. Kailangan pa rin yung post-marketing surveillance na kailangan minomonitor pa rin natin ang bawat isang individual regarding sa mga effects nito sa isang tao. And then there are still 2 other conditions. So kailangan meron ho tayong mga safeguards even though we are trying to exempt yung para sa phase 4 ng bakunang ito para ma-access na po agad ng ating mga kababayan.
Kung yung phase 4 exemption, is it reasonable to say na we might have a COVID-free Christmas 2020? Tama ba yun? Kasi may mga nagbabanggit din nun eh.
That I cannot say as of this time, ma'am. I'm sorry. But everybody's doing their best para po maka-access tayo agad, para magkaroon na rin po ang ating mga kababayan. And hopefully, this is something to hope for, no, para po sa ating lahat.
Ma'am, ano po yung pagkakaiba ng phase 3 at saka phase 4? I mean, what exactly goes on sa phase 3 and what goes on in phase 4? More importantly, ano po ba yung objective ng phase 4 that we're willing to rush through?
Well, actually, ang phase 4 po, tapos na yung phase 3. No? Phase 3 is when you try it out sa mas madaming tao nga. As I've said, mga libo-libo na pong tao yan. When you go to phase 4, you are just doing the surveillance already. So ito na po yung post-market na tinatawag na pinag-aaralan na natin, minomonitor po natin yung mga nabigyan, tinitignan natin kung yung mga epekto sa kanila, both bad and good. Yun po yung phase 4 ng clinical trial.
But then what does that mean? Then what does that mean na may proposal na kanyo sinusuportahan ng mga dalubhasa na I don't know, I don't want to put words in your mouth, but my impression was either we expedite phase 4, we shorten it, or we do away with it. Ano po exactly? And kung tama po yung pagkakaintindi ko na phase 4, ito yung minamatsagan natin kung may masama pong dulot sa phase 3, it seems to be a very important phase.
Oh, well, yes. That's why we have safeguards. No? That's why, sir, I have mentioned that in the specific recommendation, no, for this Bayanihan Law Phase 2, yung Bayanihan 2 po, nakalagay talaga yung specific conditions. Nakalagay po doon, dapat yung bakuna na tatanggapin natin, although i-exempt sa Phase 4, ay dapat aprobado po yan ng WHO. Ito po ay recognized by international institutions and reputable na mga regulatory agencies. Pangalawa po, kailangan po ito po ay gagawin pa rin natin yung pagmamatyag. Hindi naman po natin tatanggalin totally. Kung hindi, mawawala lang siya dun sa proseso para makapag-aproba na tayo agad. Pero it's still going to be done because it's really important. Kasi matagal din po ang phase 4 because when you do surveillance, you are going to do some form of monitoring, analysis of all of these individuals that were given by ng vaccine, and that will take time. So, because we have a public health emergency, nakita naman ng mga eksperto na pwede naman natin yan gawin, pero wag na lang yung parang formal process that it's going to really take time. Gawin na natin, pero safeguards tayo.
Sinong uunahin na bigyan ng bakuna kung sakaling pasado na hanggang phase 3?
Hindi ko po masasagot pa, no? So as I've said, ito po ay pag-uusapang maigi because there would be some form of prioritization. But as our president has mentioned during one of his speeches, he said that about 20% can be given, with this vaccine. And these 2 doses kasi po itong bakuna na ito. So we were trying to estimate then about 40 million doses ang pwede natin makuha at the initial. Pero syempre, kung mas madami pa ho ang makukuha natin, bakit naman po hindi? Actually, we have allotted funds already, nakapag-budget na po ang Department of Health for the budget ng 2021 para po kung sakali, ready po tayong bumili talaga ng bakuna.
At libre po bang ibibigay yan sa mga ipa-prioritize?
I think so po because we had been ordered that we will be allotting this money for the vaccines for COVID-19.
Ma'am, however, we want to navigate the... sorry, Ami, go ahead.
Magkakaroon din ba ng information campaign? Because the phase 4 is usually for monitoring yung mga possible side effects, no? And kung sakasakali magkakaroon ng contraindication yung mga drug And considering our experience with Dengvaxa, for example, will you be launching also an information campaign just to warn people about the risks they will be undertaking kapag nag-administer ng vaccine na ganito kaaga at the stage of development?
Yes, definitely, ma'am. That's part of the safeguards and the conditions that we have included in proposal for this para sa bayanihan too, no? That there would be community engagement, there would be preparation of the community with massive information campaign so that people will know about the benefits and also about the side effects or adverse effects of this vaccine if and when we are going to implement this.
Have you received questions from the public about it, or have you received expressions of concern about it? Na yun na nga, yung mga side effects, baka pagdating ng vaccine, ganon.
Wala pa naman ho kaming masyadong naririnig ukol dito, no? And media naman, kapag ho nai-interview ako, they're just asking for the details. We have not received any negative pa naman or nagtatanong na mga natatakot sila. Wala pa naman po. But of course, no, we are going to address these concerns. As I've said, we are going to engage the community prior to the implementation or prior to the immunization.
Ma'am, linawin ko lang po, nabanggit nyo nga po na may mungkahi na nailatag to how to deal with phase 4. Kung gagawin po yon, it will take legislation or kaya po ba daanin sa executive order?
Well, as we are going through it now, it is in the form of a legislation because it is high time naman po, no, timing, because we are trying to have the Bayanihan 2 approved. So, the interagency task force deemed it best, no, na isama na lang po doon para magkakasama na po lahat ng kailangan natin for this public health emergency.
Okay. Now, in the meantime po, I mean, with regards to the public, I mean, I think that was a good point that was raised in the introduction. May pangamba po ba tayo na masyadong nag-aantay yung mga tao sa bakuna? In the meantime, there's still the big thing of teaching people how to behave properly and how to worry about prevention more than anything in their behaviors. Do you think talking about vaccination in the meantime could cause our people to lose focus on what's still in their hands?
Yes, sir. That's why in our communications, lagi po namin binabalanse yan, lagi po namin sinasabi na hanggang wala pa tayong bakuna, ito po yung mga kailangan nating gawin. Hanggang wala pa po tayong bakuna, ito po yung pinaka-effective na pwede natin ipanlaban dito sa virus. And these are the non-pharmaceutical interventions. And I think, even dumating na yung bakuna, kailangan pa rin po nating paulit-ulitin na ito pa rin ho ang ating mga public health standards, no, health standards na kailangang ipatupad pa rin hanggang nandyan yung virus. Even though there would be a vaccine, we would still be implementing the minimum health standards.
Ma'am, kanina po nagreklamo po si Quezon City Mayor Joy Belmonte na parang napakabagal nga raw po ng nagaganap na contact tracing at lumabas rin sa mga usapin na yung mismong Department of Health daw pala ay hindi nagko-conduct ng sariling contact tracing, no? Paano nyo pong sosolusyonan itong problema ng kabagalan ng contact tracing kaya tuloy hindi rin kaagad ma-test ang mga dapat ma-test so that we can have accurate numbers?
Yes, Lucy, alam mo, ang contact tracing is a responsibility of the local government unit. Nung nag-umpisa po tayo ng response natin dito sa pandemyang ito, totoo po yun, ang Department of Health ang bumababa, yung pong mga teams namin, kami po yung bumababa, maliit pa lang ang mga kaso, tinutulungan kami ng aming regional office at saka ng local governments. Pero nung pong nagkaroon na ng resolution sa interagency task force na sinabi, ang DILG na will lead the contact tracing efforts, nagkaroon na po tayo ng parang mga capacity building para po sa ating mga local government unit contact tracers para sila ay capacitated, they are skilled, no? So ito po ay isang task na local government units po talaga ang gumagawa. Actually, meron pa ho tayong joint administrative order na nakalagay pa ho doon yung ating komposisyon ng mga barangay health emergency response teams na sasamahan po sila ng ibang mga local officials katulad ng PNP, ng BFP at iba pang mga local stakeholders na naandun para po mag-comprise sila nitong mga teams for contact tracing doon po sa ating mga local governments. So ang DOH po ngayon, meron kaming contact tracing teams, but we only deploy them for exceptional or special po na mga circumstances. Like for example, there is a big cluster of infection in a closed institution, pinupuntahon ho namin yan. That is because we do surveillance. Meron hong big cluster of infection in a specific workplace na malaki, like maybe in a doon po sa mga techno park, pinupuntahan ho namin yan, iniimbestigahan kasama ng regional office namin for surveillance. But for the local government units, ang meron pong obligasyon para sa contact tracing ay ang mga local government units po natin.
Pero ngayon ang performance nga raw po ay subpar, no? Sa halip na, if I'm not mistaken, sabi ni contact tracing czar Mayor Magalong, no? Sa halip na around 30 traced persons dapat to one positive patient, ang nangyayari mga 7 lang daw or 8, no? Which leaves so many others na hindi na mo-monitor. Meron ho bang diskusyon within the IATF kung paano pang masosolusyonan yung napakababang record of tracing ng mga LGU?
Yes, Lucy, alam mo, ilang beses kami nag-meeting, no, with the Metro Manila mayors, kasama po si Mayor Magalong. Pinaliwanag po ni Mayor Magalong yung kanilang sistema sa Baguio, how it was how it became successful, no, and effective. Kasi sabi niya, sa isang tao sa kanila na confirmed na positive, 37 na mga katao ang kanyang natitrace. At saka na-i-isolate at natetest nila. So naging modelo po ito, no? So sinabi, tinignan natin ang mga datos ng bawat LGU, tinignan how far are they from this 1:37. At doon nga nakita na may mga gaps talaga. That's why we have, because of these recalibrated strategies that we have, we introduced the code strategy. Ito pong coordinated operations to defeat the epidemic. Kung mapapansin niyo po, ito pong nakaraang 2 linggo, bumababa po ang ating mga cabinet officials, sila Secretary Duque, National Task Force, National Implementation Committee, nandyan po sila sa mga barangay. Kasi nag-identify po tayo ng mga pwede nating puntahan ng mga barangay dahil medyo priority area sila at gagawin natin ang code. Ang code strategy po, ang mainstay niyan, no, is integrated po ang response niyan. Maggagawa tayo ng active surveillance, magbabahay-bahay po active case finding. Hahanapin natin sino yung may mga simptomas, sino yung mga na-expose, i-isolate po natin ang mga taong yan. We are heavy on the isolation and the tracing of contact. So halimbawa, pag naghanap po tayo ng mga tao, nakakita tayo, we will know at once kung sino yung mga na-expose sa kanya. We will go easily, no? Easily napupuntahan at ma-isolate agad ang mga tao at ma-test. So ito pong strategy na ito for these 2 weeks, no, na binigyan tayo ng MECQ. The hope is na prime natin yung system so that other LGUs will follow suit. Gawa po natin yan hindi lang sa Metro Manila, pati sa Laguna, sa Cavite, sa Rizal, pinuntahan po lahat yan. Tinignan lahat ng gaps ng kanilang system, pinakita sa kanila how the code team will work, kung paano yan mangyayari. This is based on we are adapting the Dharavi model from Mumbai, no? Ginawa po nila yan sa kanilang lugar, nagbahay-bahay, tinignan kung sino may mga simptomas, in-isolate po lahat yan at na-contain nila yung transmission. And hopefully we can do this dito po sa ating mga barangay dito sa Metro Manila at doon po sa mga karatig lugar natin dito sa Metro Manila.
Ma'am, matatapos na yung MECQ, makakahabol pa ba? I mean, by that time, kasi mas mahirap habulin pagka nag-GCQ na ulit.
Alam mo, Lucy, kailangan maintindihan ng mga tao, ito pong 2 linggong ito, hindi naman natin sinasabing matatapos natin lahat ng barangay na yan. Ang ating objective is to prime the system, to show the local government units that they can lead in the implementation and then the implementation can be strengthened, no? Yung pati po yung mga lockdown na ginagawa natin, binigyan po sila ng guide kung paano gagawin. Now we have a model, we have tried it out with other barangays and we can see the effects. You look at Navotas now po, no? Maganda po ang nangyari dito sa Navotas. Napababa po ang kaso because of this extensive lockdown. Ginawa niyang granular per kalye kung saan siya nakakita. ginamit niya po yung formula ni Mayor Magalong at nakapag-trace siya ng madami, nakapag-isolate siya ng madami, and unti-unti na hong bumababa ang kaso ng nabotas. So ang hope po natin, ang objective for these 2 weeks na ginawa natin ito, magawa po din ng ibang LGU so that we can eventually contain the transmission of the disease.
Alright.
Health Undersecretary Maria Rosario Vergeire, maraming salamat po ulit for joining.
Thank you very much.
Ma'am.
Thank you.
And we need to take a break. Please stay right there. The chiefs will be right.
Welcome back to the Chiefs. We are now in the final stage of our conversation. And now joining us is the Director of the Philippine General Hospital, Dr. Gerardo Legaspi. Good evening po, Doctor. Dr. Legaspi. Hindi yata tayo narinig. Well, good evening, Dr. Legaspi. Can you hear us? Yes.
Yes, we
Yes,
can hear you.
Yes. Welcome to the Chiefs. You issued an interesting paper this week, no, tungkol sa mga lessons learned from COVID. But before that, I want to ask you what the situation is now in the PGH with regard to the pandemic response. Kasi dati we had the impression na malapit-lapit na kayong ma-overwhelmed. What's the situation now? Doctor Legaspi? Dr. Legaspi? Hindi yata tayo narinig ni Dr. Legaspi.
Either that or mahaba yung gap ng, well, no pun intended. Malaki yung gap.
Mahaba yung ano nila eh. May statement sila eh. Lessons learned from the COVID pandemic. Napaka-detalyado.
Actually, ano bang balita kay Dr. Jonas? You remember him?
Yes.
Diba? Ano rin siya? Nagkaroon din siya ng
Before we
Dr.
discuss
Jonas?
the paper, Doctor, can you hear us?
Yeah, but just to inform you, I'm sure Dr. Jonas Rosario has a lot of friends.
Gumaling na
He's
siya.
now
Kamusta na
home.
po
He's
siya?
recovering well from
great,
his
great.
COVID infection, and I think it's a matter of time before you see him again on broadcast.
Good.
Great. That's good to hear.
Kumusta naman yung hospital ngayon, Doctor, before we go into the lessons you learned from the COVID response? Kumusta naman yung
Okay.
PGH ngayon?
Yeah, so just like any other hospital in the last, maybe in the last month, we've been seeing a gradual, steady increase in the patients, which peaked
Yes.
a week ago, 2 weeks ago. But since we've been a COVID referral center for almost 5 months now, I think these peaks are nothing out of the ordinary for a hospital like PGH. Although we observed sicker patients that were coming in, meaning they had to stay longer in the ICU. In fact, the people who didn't make it were a bit more this time around, but the number almost reached 220 at one point during admitted patients. But I think as I said, the system that has been in place for almost 5 months now helped us get over that surge, and slowly we're seeing a gradual decrease in the number of patients that are being admitted. So now we're, I think, at around 170, which is 30 less or 40 less than we had 2 weeks ago.
So in the
170
in the 5 months,
from a peak of 220, you said 200. It peaked at 220. You're now at 170.
may ano siya, no? May gap siya sa
May delay yata.
May
Malaki.
delay. May delay. Doctor.
Yeah, I think,
Dr. Legaspi.
sorry.
Yes.
Yes.
Yes, you heard Robbie Alampay? You heard the question of Robbie Alampay?
Sorry, I didn't get that, Robbie.
Oh, Robbie.
No, I was just trying to clarify. You said 170. That was from a peak of 220. You said.
Yes, 2 weeks ago.
Okay. Now, Doc, we want to get into as you said, the lessons learned, and really, if there's any institution right now
Mahina yung ano ko
that might have. Can you hear us, Doc?
Doctor.
Doc, can you hear us?
Yes, sorry, I
May
think,
delay, may delay. May delay lang siya.
No, I think may problema sa ano. But anyway, Doc, can you hear me now?
Doc, can you try removing your earphones?
Earphone.
okay.
That might help.
Yeah.
Get there.
Is
That
this
might
better?
be better.
Yes.
Yeah, that's better.
Okay. So, Doc, diretso na tayo sa lessons learned.
So
Why don't you take us through the biggest lessons learned, the biggest insights from PGH?
Now I have to move.
Okay, sige po. We'll give Dr. Legaspi time to adjust.
Yeah.
Just like yung Wi-Fi sa bahay, kailangan na hanapin ko sa malakas. But I mean, there seems to be some good news there. Dr. Legaspi certainly did not look like somebody who was not in control of his institution. If anything, he's saying there are signs that mukhang may nag-improve dito, nag-i-improve.
At least nag-i-improve.
Ano kaya yon during the MECQ period? Yeah, there is.
Okay na tayo.
I think it's a combination of the stricter quarantine protocols, and also, if you remember, the DOH has required more hospitals to allot at least 30% of their beds to COVID. So
increase.
Not decongest.
Yeah, so if you remember, 4 months ago, there were only 3 COVID referral centers. Jose and Rodriguez Lung Center in the Philippine General Hospital now. Almost every other hospital is a COVID hospital. So I think it also helped that the load was distributed among other hospitals, and I think the sign that maybe the infection is getting a bit more control is that less of our healthcare workers get infected also on a daily basis. In the community, at least.
Doc, let's get into yung insights nyo. I mean, lesson 1, I want to jump to 2 and 3 if you don't mind. But lesson 1, as you said, is everything must be science-based. Let's listen to our scientists. But in lesson 2 and 3, refers specifically to what you've learned about the different kinds of tests. What do we know now with regards to PCR, rapid antibody tests, and so on?
So I think the most glaring lesson that we've learned is that we had the fortunate circumstance of having the 2 tests available, the PCR and the rapid antibody tests, and we were able to test them side by side in 3,033 patients. So what we found out is that the rapid antibody test only predicts 20% of those who were really positive. So
that low.
That low. So that means you're missing out on 80% who would have been positive, and they'll be walking around thinking they're negative. So there is no data anywhere else. That's why we thought we subjected that to statistical analysis, and then we in science we call it a high confidence interval. So we decided to maybe use it as a basis to recommend the non-use or to stop using rapid antibody tests to screen for COVID-19. So
Pero hindi pa
it's
rin
a
eh.
very complex science of immunology. I don't think it's easy to understand from a businessman standpoint or a policeman standpoint or any other area which is commonly used. So although it still has its use as when we do our convalescent plasma screening,
Yes.
we use it to see if indeed the antibodies have been formed already.
Yes.
But then
Right.
again, it's not very accurate. Still, the higher technology of ELISA and ECLIA give us a better level. So uh, generally, I think we cannot put too much weight on what the rapid antibody test will tell us on the ground. On the ground. So
Right
the
now, yung protocol, Doc, that the IATF and the DOH recommend is to use it as an initial test. At yung mga magpa-positive doon, yun yung mga EPPCR. So you're saying that that's not even going to work?
well, as I said, you'll miss out the 80% who So you will not do PCR testing on the 80% who turn out to be negative. We're talking about
Yeah.
asymptomatic patients. These are
Yes.
patients walking around without knowing that they have the infection. Some of them.
Yes.
So I don't think that's a recommendation of the DOH. In their
Yes.
latest statement, I think the statements its use is for surveillance. No, I think the way I understood the stand of the DOH on the rapid antibody testing.
Pero
The
yun pala ang
interpretation of
ginagamit ngayon, eh,
IgM,
no? Yeah.
the interpretation of IgM and IgG is more complex than we think,
Yes.
especially if you interpret it together with clinical findings. So I think we should not we should not we should not discount the possibility of missing out some of the findings because we concentrate too much on the test. No? So it's still important to do symptom screening, which I think even the other doctors are saying might be even more sensitive than a rapid antibody test, screening for symptoms.
So PGH no longer uses the antibody test. Puro na lang kaya yung swab
As I said, we only use it to screen,
for
to initially, to just have an idea for our convalescent plasma
Yes.
donors.
Yeah, doon na lang.
Indeed, some of the antibody tests are reviewed.
Oh.
So, as far as PCR is concerned, I think we also have made a statement that maybe mass testing,
Yes.
that the technology and the resources of PCR testing is better, is more rationally used by doing targeted testing. So the problem
Ano
with
ba yun,
mass
Doc?
testing.
Yeah.
So I think the extensive guidelines that DOH and PhilHealth have released is quite already leads us to the proper use of it. So it actually eliminates the random. You walk in, you just want to be tested, and we test. It doesn't happen that way. There are certain conditions that tests are done, and has been divided. It has been categorized for healthcare workers, people exposed to possible exposure to COVID-19 or symptoms related to COVID-19. So I think the important part of that is that the danger of someone walking in having a test done is sometimes the patients are not given proper advice when they test positive. We've had some patients who came to us with positive results, and they were not told by the laboratory that tested them on what to do next, or they were not told to isolate themselves or to take the precautions that are necessary. So I think Aside from just testing patients, the important part of advising them, which starts actually the control of the infection, is to isolate them early. So,
Doc,
um,
another hmm, yep. Doc, another major insight that you shared is I'm reading this directly so I don't misquote it. Contact tracing is time sensitive, should be initiated immediately. And by immediately, tama po ba itong nababasa ko? One thing is it says, by immediately, we certainly do not mean 1 week. But it also says here, even 1 day delay could cause you to lose the impact of contact tracing. Am I even reading this right? Even 1 day is going to be too slow?
yes, because in 24 hours, one person could have encountered
Yes.
already 37. In walking around. So I guess the basic principle that we should follow, that I would like my employees to follow, is if you have yourself tested, then you're suspecting to be having COVID-19, you should isolate yourself from there. So that's the
Uh-huh.
first step.
Right.
If you're even thinking of having yourself uh, uh, tested because
Tested.
you suspect you might have been exposed to somebody, on your own you should already have yourself do your share by isolating yourself and start thinking of the people that you have come across. So because as you walk around waiting for your positive test during the day and you find out you're positive at the end of the day, you could have infected a few people who will infect other people as well. So that's why I said that maybe even 1 day might be too late. So but of course, it's an exaggeration. But in a pandemic like this, I think being cautious cannot be over exaggerated. So I agree with the protocols of uh, Mayor Magalong. I think they're
Yeah.
very sound and quite effective as well.
Doctor, yung pooled swab testing, do you think that will work? Saka meron bago ngayon yung antigen test. Is that okay with the PGH?
So I think in terms of sensitivity, the ranking of the test is the PCR test is
Yes.
still offers the best sensitivity, and the antigen test, and
Yes.
then the serologic testing. So in that sequence, probably yes, we can on a screening purpose. We'll have to wait for the validation of the antigen test. The
What about
advantage
the
of the
pool
antigen test.
testing?
Yung pool. Yung pool.
Dr. Legaspi, yung
Uh,
pool
PCR yun eh.
testing na yan, pero
You think,
PCR
yeah.
yon. Do you think
you
that
think
will
it
work?
So the pool testing, it will work, but the question is how many is optimal. So let's say you have a barangay and there's an outbreak. You want to check families, pull them, 5 of them or 6 of them, and then
Mm.
if they all turn out negative, then you only did one test for all 6. If
Oo.
someone
Yes.
tests positive, then you do 6 again for the rest.
Yeah.
So I think
Yes.
it will work, but the studies that are being done now is to determine exactly how many is optimal, how many people
Mhm.
are optimal in terms of getting the efficiency of the test that you want. So, but if you imagine if there's a high infection rate in the community, the chances of you getting a positive in a pool becomes higher. So you actually repeat those more. So,
Mm.
but there's a group studying pool testing, and we'll wait for their advice. I think soon will be coming out with their report.
Doc, the 2 week timeout that the medical community asked for lapses this week. What did you feel? What was the impact of the 2 week timeout? Did it make a difference? Could you feel it? And equally important, what do you want to see happen next?
Okay. So I think the 2 week timeout, just like the previous ones that we've had in the past, gave us again more time to prepare. So the mere fact that there was a higher quarantine protocol, people became more aware again now of safety precautions, health precautions. and of course, people move less. We will probably start feeling the effect of that, like what we did before, maybe after this week has passed. No? So what it has allowed us is to again restock on inventory and prepare the infrastructure needed to make us sustain our operations for the long run. But I think the most important impact of that is that people again were made to realize that we really have to be careful with what we do outside of the hospital. So I think the MECQ has reminded everyone again that it's not uh, as simple as starting to go out again because the infection rate in the past has gone down. So we have seen uh, that effect. As I said, I used the gauge. I used the infection rate of our healthcare workers as a gauge of that effectivity. So it has gone down significantly when we did the MECQ. So um, just to share with you, when we did our surveillance, our testing of 4,800 employees, we were so happy that only 2% were infected. But
Oh,
a week
okay.
later, but a week later, we had a rush of infection.
Why?
So
Oh,
we,
bakit?
we had probably 4% or 4.7% infection rate of those who were coming in
Ah,
because one, maybe the negative result made them careless, made them forget
Oh,
about the
yeah.
protocols. They
akala
probably
nila
even said, "Oh, I'm negative. Sige, kumain na tayo or inuman na tayo."
Mm.
Parang ganun. And then
Yeah.
also, it also reflected the increasing uh, infectivity or transmission in the community because some of them were already going home as in a GCQ. No? So
Mhm.
it came
Yes.
to a point that we were actually protecting the hospital from the community
Oh,
rather
wow.
than the hospital protecting its healthcare workers inside the hospital. So I
Oh.
think that happened also with the companies, factories. No,
Mm.
so it's the realization that really the battle is not in the hospitals; it's really in the
Mm.
community.
Doctor,
Mm.
tama na ba yung 2 weeks MECQ? Would you recommend, because some sectors are recommending 2 more weeks of MECQ, at least for Metro Manila and the neighboring 4 provinces. Kayo, kung tatanungin kayo, would you recommend an extension?
Well, if you go historically, it's the only one. It's the only intervention that probably will work in decreasing the infection rate. But of course, all of our strategies have to be balanced with the other effects of this pandemic, which is economic impact. No? So,
Yes.
um, although our role is really to take care of those who get sick of the disease, I think equally we have to be prepared to to help out in the event that maybe a less stricter quarantine is imposed.
Yes.
Because although we think another MECQ will really bring down the infection.
Mm.
I don't think
The
the
economy can
other effects
handle it. Yeah.
can
No?
stand it.
Yeah.
So it's really a difficult balance. But as I said, maybe the 5 months that we've been running hospitals with COVID patients have taught us more lessons. And maybe we can handle if there's going to be another surge, we can handle that again also.
Okay.
Okay. All
Dr.
right.
Legaspi, Director of the Philippine General Hospital, we'd like to thank you for joining the Chiefs. Good evening po,
Thank you,
Doctor.
Doc. Good
Maraming
evening.
salamat po, Doc.
Thank you also. Thank you. Nice to see you again, Lucy.
Yes.
Thank you, sir.
Thank you.
Mukhang nag-i-improve naman yung PGH, ano, at least.
Yeah. Oh, that's good news, really.
Yeah, and obviously all appreciation for all the frontliners, hindi lang sa PGH, pero lahat ng hospital.
Yeah.
Yes.
Yeah.
Although may binanggit siya na ano, no, yung medyo may binanggit sila dun sa ano na fatigue with ano, with all the work, yung PPE, with the use.
Siyempre naman.
Anyway,
Yeah.
no? But at least mukhang maganda yung kanyang news. But anyway, that will be all for this edition of the Chiefs. We hope what was discussed here will keep the conversation going. I'm Ami Pamintuan of the Philippine Star.
I'm Lucy Cruz Valdez of News 5.
I'm Robbie Alampay, and we are One News.